Hello and welcome to Getting Your Money's Worth. I'm Judith West, host, and this is the show that focuses on value. Our guest today is Dr. Margaret Furman, associated with Beth Israel Hospital, practicing cardiologist in the Department of Cardiology. Hi, Margaret. Thanks for being on the show.
Thank you so much for having me.
You're welcome. Okay, let's get to some brass tacks. For one thing, you are a female cardiologist. That's pretty rare, isn't it?
The numbers are small, although it is increasing, the number of women going into cardiology and practicing. Currently, the last numbers I've heard is about 10%.
Okay. All right, but it's not typical.
No,
choice.
not at all.
Now, but so going then from there, is heart disease a high risk for are females at high risk for heart disease?
Absolutely, it is
Really?
the number one killer.
Not breast cancer?
At this moment, still coronary artery disease, heart disease is the number one killer for men and women.
Really? Yeah. So do the same symptoms and the same therapies apply to both sexes?
Symptoms, to begin with, symptoms, although the typical presentation of someone with heart disease is chest pain, chest pressure, related to exertion, associated with trouble breathing, women tend to present more often with the atypical symptoms, which can be just fatigue, just not feeling right. They don't have to have the chest pain.
And you know, Margaret, part of what I've read and I heard actually is too that very often when women present themselves to their doctors with fatigue, I'm tired, I don't feel good, I have no energy, I'm not myself. It's kind of blown off as, oh, this is, another form of ring around the collar or something. And it's not treated as though it might be symptomatic of a heart disease.
Yes, that is true. Right now as well, women aren't treated the same. They're not treated as aggressively as their male counterparts.
And they certainly are not part of the studies that go on.
No, we account for much less of the studies. I think a lot of times when women present with these more generalized vague complaints, as you can call them, or fatigue, they get more easily blamed on depression,
right,
or stress, and not looked at that there really could be something going on more serious.
Okay. So one of the things that we are going to do on Getting Your Money's Worth is bring some attention to the fact that yes, heart disease is the number one killer for women. And if you think that something's wrong with you, stand up for yourself when you go to the doctor.
Yes, that's what we've been hoping to do. That's why February and Heart Month.
This is Heart Month, and you are trying to educate in that arena, are you not?
Yes.
Right.
I mean, the most important thing is educating yourself and going to the physician and being seen.
Right. And being your own, an advocate for yourself.
Absolutely.
Yeah. But you mentioned the whipping boy for everything, stress. How much of a factor is stress in heart disease?
Stress
on a scale of 1 to 10.
It's a high number, probably 8. It affects
really?
you many different ways. Number one, the actual stress itself causes your heart to work harder, pump harder, circulating the blood. Additionally, then it affects other factors that play a significant role in heart disease. It can increase your blood pressure. If you already have elevated blood pressure, you won't be well controlled. It can cause you to go back to bad habits such as smoking, overeating, not exercising.
You talk about something in your in your talking points from the articles that you have written. You talk about the unhappy heart syndrome. Is that
Yes?
Is that a condition, the unhappy heart syndrome?
There is a better medical term for it in our world. It's called Takotsubo cardiomyopathy.
Okay, we'll use AKA unhappy heart syndrome,
or the broken heart syndrome.
The broken
Other people may have heard. That syndrome can present absolutely identical to someone having a heart attack. It can present with the same chest pain, acute onset, trouble breathing. Their EKG electrocardiograms in the emergency room can look absolutely identical. They can even make enzymes. The difference is usually there's a preceding emotional or physical recent stressor. And when I'm talking recent, I'm not talking a week ago. It's even typically earlier that day. It can be hearing the loss of a loved one,
Right.
getting a bad prognosis or diagnosis of a disease.
Or something very traumatic.
Yeah, either physical or emotional, very traumatic, or physical of going through like something is lithotripsy.
And then is this a legitimate heart attack or just a faux?
It's not. The difference is when these people undergo cardiac catheterization or angiogram, where we take a look at the arteries of your heart, you don't have significant blockages in your arteries. What you do see is their heart function is abnormal, and the walls of your heart aren't beating as well.
So going from that, though, this unhappy going, using and focusing on broken heart or unhappy heart, does happiness count in heart disease? Or, I mean, is a happy person less likely?
I think you're talking about two different things: coronary artery disease, blockages in the heart, and the unhappy heart syndrome, which carry different prognoses. With regard to general coronary artery disease, blockages, when we talk about atherosclerosis, I think general happiness does, because associated with depression will be the increase of other risk factors such as poor eating, lack of exercise, contributes to obesity. And all that definitely plays an important role in increasing your risk for heart disease.
So to keep the two things separate, all symptoms do not necessarily mean a heart attack, but all symptoms should certainly be looked at and treated seriously.
Absolutely.
Okay. You also write or talk about preventive cardiology. What is preventive cardiology? Is that actually a science?
The idea is we look at things in different levels of prevention. Primary prevention, before it actually ever happens, before you carry the diagnosis of coronary artery disease. Secondary prevention, once you've had...
What is primary prevention?
Primary prevention is controlling the risk factors that will cause or lead to a heart attack, such as high blood pressure.
Okay. So the risk factors in women, in general, or in women?
Both. Most of the risk factors are the same.
Are the same. High blood pressure.
Yes.
Is high blood pressure inherited, or does high blood pressure come from lifestyle? Does it come from diet? Where does it come from?
It is multifactorial. Yes, there is a genetic relation, family history that will contribute, but as well as environmental factors of eating. If you're eating a lot of salt, obesity will also contribute. There's also other diseases that can cause high blood pressure, and those need to be evaluated.
And indeed, high blood pressure is at onset for heart condition, but controllable.
It is controllable with medication and lifestyle changes, exercise, avoiding salt. Don't eat the Chinese food 3 times a week.
Right. Salt seems to be a no-no all the way around. Okay, so high blood pressure is a high-risk factor.
Yes.
Stress we've already talked about, right, to the extent that it can be controlled. These are stressful times, Margaret.
It's hard. I mean,
what are people to do? I mean,
we're seeing a lot
of people today are having a very hard time living. What are they to do?
Important things is do things that make you feel good, like you mentioned. Perhaps when you go on a break, or if you get a lunch break, take a walk around the block, especially now the weather's hopefully getting nicer.
Right.
If you don't get to routinely exercise tends to make people feel better.
It makes you feel better.
The mood gives you a more positive mood change.
Right. Unfortunately, when people get stressed, as you said too, especially in stressful times, they tend to grab snacks and start eating junk food.
The other thing is to be aware. Number one is awareness of your habits and what you do. If you tend to like to do junk food, try to switch. Have that apple more easily handleable. Make it easier for you to get healthy.
I mean, I have found if I don't buy it, if it's not in the house, then it's not around.
But if you're at work, stick some healthier granola bars in your desk drawer that won't go stale sitting there for a day or two, and more easily accessible.
And sometimes too, people tell me that if they just wait it out, they forget about it, it kind of goes away in 10 or 15, 20 minutes, and they're moving on with their work. Right. Okay. So exercise, stress control, high blood pressure, anything else?
Well, smoking, and I think during the stressful times, a lot of people have turned back to smoking. And we know it is a significant risk factor for coronary artery disease as well as several other diseases.
Have you seen a increase in coronary heart disease with the economy turning down?
I don't know. The economy is more recent to really be able to see those numbers differences. Yeah. I have among my own patients see several either revert back to unhealthy habits or smoking again. Overall, when the smoking bans went into effect in New York and other cities, the studies show that the number of heart attacks did decrease.
Right. So that we can thank Mayor Bloomberg for that piece of health.
I think the idea is people think, oh, one cigarette here or there won't be that bad.
What about alcohol?
Alcohol affects the heart two ways. Yes, it increases your cholesterol, affects your fats. It affects your heart.
I heard that a glass of red wine is really good for your heart. Is that true?
Yes.
Do you subscribe to that?
Yes. A glass of red wine especially, or white, but red wine the most a day will. But any more so will actually have a more detrimental effect. It's what we call a J-point curve.
Right. People are living longer these days. So does that mean that there's a better therapy for heart disease?
There are better therapy and medications. I think we have come a significant way from the past, but we still have a way to go. And I think we're making people live longer, so eventually they are developing heart disease or eventually more deleterious.
And there's so much more. There's so much more intervention, right? So this is National Heart Month.
Yes.
How did that come to be? Is that a national?
It was designed nationally as part of the Healthy People Now 2010. It was originally Healthy People 2000, where the country set certain goals for us to achieve, focusing on either weight, obesity scale.
Goals for everybody to achieve?
Across the board, various in those states. It was looked that there's numerous goals, whether for prevention of screening for colonoscopies, exercising more for the heart, and for education purposes, they sort of decided to designate each month as awareness, and February is Heart Month.
And certainly prevention and information, because it's certainly also not only a way to live longer, but one of the things that we're battling in this country is health costs. Prevention is certainly a very costly, cost-efficient.
Yes. Prevention is the best way, especially if you even look at the other countries in Europe and the world where they focus more on prevention than we tend to. They spend much less of their gross national product on healthcare. And I think people need to be aware. I think education and awareness of one's own risk factors. Find many times people like, oh, I didn't know I had high cholesterol until we're seeing them for their first heart attack.
Right.
Checking the 25-year-olds even younger if they have heavy family history.
So you're never too young to check?
I don't believe so.
Okay. All right. Thank you for being on the show, Margaret. And thank you for watching. I'm Judith West. February, National Heart Month. Check yourself. Thanks for watching.